Hi everyone, it's Dr. Hall. We're going to start on lecture 17, which is about both lateralization and language. So pretty straightforward, our outline for this lecture. First, we're going to talk about lateralization, about how different sides of the brain are doing different things, and then we're going to talk about language. So first on the expressive side, or the motor functions involved with language, and then on the receptive side, or the sensory functions involved with language. So let's talk about lateralization. The right and left sides of the brain, the cerebral hemispheres at least, are separate from each other. They are two distinct halves, and they do have some differences between them. However, if you have seen, this is very kind of popular in popular science and pop psychology, that the left side of your brain is analytic and rational and does science and math, and the right side of your brain does things that are artistic and creative and passionate, and that you're either more a right-brained person or a left-brained person. Research actually shows that this is not true. So this idea of one side of the brain being all rational and the other side being very creative, that just hasn't held up under research. So both sides of the brain seem to be equally involved when we are doing a lot of these tasks that are classically considered right-brained or left-brained. Actually, both sides of our brain are involved. So that doesn't seem to hold water, but there are some differences that can be measured. But overall, they're both equally capable of doing most of the things that we do in our lives. The one exception is language. So language in most people, so in over 70% of people, far closer to 90% of people, is located on the left side of the brain. So that is the one exception for which we have very good data. Everything else, maybe a little bit here, maybe a little bit there, but it's not like this is the side of me that dances and paints, and this is the side of me that does algebra. It doesn't work that way. So mostly the differences are which side of the body that it's talking to. And we've talked about this before when we talked about the contralateral organization of the central nervous system. So remember that crossing of tracks. And so as we learned about the somatosensory system, we learned about how things come up and cross. And when we learned about the motor system last week, we learned about how things come down and cross. So most tracks, which are groups of axons, cross from the right to left and vice versa. So for most things, most of the time, the right side of the brain is receiving information from and sending information out to the left side of the body, and vice versa. So you should be very well familiar with that by now. So that is a true difference between the two sides of the brain, is which side of the body they are talking with. Now, of course, they're each doing their own thing, but they have to be able to talk to each other and knowing what's going on the other side. So we do have several bands of white matter, so it's axons, right? So signals traveling to and from one side and the other. The biggest of these is the corpus callosum. That's the structure that you're probably very well familiar with already. That large band of white matter running from one cerebral hemisphere to the other. There are two others. There is the anterior commissure, which is a little band of white matter that kind of runs, can you see that? Let me change it to red. Usually around this area, kind of right in front of the thalamus, and it goes one to the other. And there's another one, which is the hippocampal commissure, which the hippocampus is located around here, so that kind of also arches up and over. So these bands of white matter, then the corpus callosum, the two commissures, allow each cerebral hemisphere to talk to each other and know what's going on. I just wanted to include this image, which is a frontal slice through that area just anterior to the thalamus, and you can see here is the anterior commissure. So running from one side to the other so that they know what's going on the other side of things. So what's really interesting then is that there are some individuals, especially historically before we had a lot of good medications for seizure disorders and things like epilepsy, where if people had really severe seizures, one of the treatments actually was to cut the corpus callosum. So actually severing that connection between the two hemispheres, because seizures are when abnormal electrical activity gets going and then it just keeps, moving throughout. All these action potentials are setting off other action potentials, right? All these EPSPs, and we're reaching threshold and so by cutting the corpus callosum, you kind of isolate that. So maybe something starts, but then it can't spread to the other side. So this is a treatment, obviously reserved for severe cases, because this is neurosurgery. You're having to do brain surgery on someone. And interestingly, the procedure only cuts the corpus callosum. So all of those other things lower down in the brain, all those crossing tracks, still intact, right? So your brain can still talk to your body and vice versa, but the two sides of the hemisphere can't talk to each other. And what's interesting is, like, how in the world can you function like that? And most people function pretty well. So you'll see a video of a patient named Joe who worked with a neurologist at Dartmouth Medical School for many, many years. And he's like, you get used to it. It just seems fine, which is amazing. All right, but people with this split brain, as it's often called, because these two sides of the hemispheres can't talk to each other, have some interesting symptoms. So, for example, if I had a blindfold on and you put an apple in my hand, on my left hand, and I could feel it, and I would know, some level of knowing, we'll get to that in a minute, that it's an apple. And then with the blindfold on, you had me take my right hand and select by feel from a variety of different objects and pick the one that matches. I couldn't do it. I would not be able to do it because my left hand is talking to my right brain. And so my right brain knows what's going on. But then in order to do it with my right hand, my left brain needs to know what it is. And it can't because the connection has been cut. Fascinating. It gets even more fascinating when then we use the fact that visual fields go to different areas of the brain to also kind of play tricks on the brain. So remember, of course, things that are in your left vision, I'm trying to get this right with the mirror thing. Your left visual field go to your right occipital lobe, and this side goes to that side. I'm just not going to say right and left because the mirror thing's driving me nuts. Okay, so remember, so the one side of your brain can only see one half of your world, and your other side sees the other half of your world. It's not by eyes, it's by visual field. Okay. Then there's the fact that in most people, your language centers are on the left. So if the left side of your brain can't see it and doesn't know what it is because it can't get a message from the right side of your brain, well, that creates some really interesting phenomena. So let me take you through this, and then afterwards, this diagram will make more sense. So let's say, all right, here is my patient, my willing participant who has split brain, and they're sitting in front of a screen, and behind the screen are a bunch of objects, so they cannot see those objects. On that screen, you can see that they have projected the image of a hammer. And then look, they've projected it onto his left visual field. So if they don't let him turn his head, right, to see it out of his right visual field, if he has to keep his head straight forward, it's in his left visual field. So that information is going to the right hemisphere. The right hemisphere has no language in the vast majority of people, right? Language centers are on the left. So if you tell them, name the object, they will say either, I don't see anything, or I don't know. They will not be able to name the object. However, if you show them an object on their right visual field, which then of course is being projected to their left cerebral hemisphere, and the left cerebral hemisphere is where you have your language centers, they will be able to say, oh yeah, it's an apple. Right? But only the left side of the brain can do that because only the left side of the brain has language in the vast majority of people. Okay, so, but what's interesting is that right side of the brain, even though it doesn't have language, it still has ways of knowing. So here's the really crazy thing. So here's that example from before. So again, we're showing a hammer to their left visual field. So it's going to their right brain, which has no language. But if you tell them, to take their left hand and find the object that they see, they will be able to do it. They will not be able to tell you what the object is, but they will be able to still recognize it and identify it as matching, because that's the right side of the brain controlling the left arm, right? Just don't have any language for it, which is just weird, because it also seems like they're also somehow not consciously aware of what they're doing. And in the video that you'll see of Joe, he will actually draw things with his left hand. So it's again, asking the right side of the brain to tell you in whatever way it can, either by grabbing that object, identifying that object by feel, or by drawing that object, what it is that it sees. Fascinating. Okay, so in summary, lateralization is the fact that each cerebral hemisphere is separate. They mostly can do all the same functions, just for the opposite sides of the body, but language is the one exception. It's highly lateralized. It is on the left side of the brain in the vast majority of people. So we have those connections where the two cerebral hemispheres can talk to each other. Corpus callosum is the biggest one, and then the anterior and hippocampal commissures are smaller ones. And so people with split brain, the one side doesn't know what the other side is doing, but they still have ways of knowing, which is kind of freaky and also kind of cool. All right, so that's it for lateralization. I'll see you next for expressive language.